Hello, everyone, and welcome to ACP Live's ongoing house call video conference coverage of what would have been ATS 2020. I'm Kevin Kunzen, managing editor of ACP Live. Today, I'm interviewing Dr. Michael Wechsler of National Jewish Health out in Denver. Dr. Wechsler, how are you doing?
Doing great. It's great to be here today. I'm happy to talk to you. I'm sorry we're not at the ATS.
Yeah, me too. I was honestly looking forward to it. It's a very interesting meeting, very impactful, and obviously with everything going on right now, very pertinent and a very important discussion. But nonetheless, the abstracts and data is available and open for discussion. And you had a role in a handful of abstracts that we have interest in covered this week. But right now, we would want to talk to you exactly about these Reslizumab findings for adults with severe eosinophilic asthma. Doc, maybe if we just started there, can you tell us a little bit about what the findings were and what you found to be the most impactful for your colleagues?
Sure. Well, Reslizumab is a monoclonal antibody that targets interleukin-5. And interleukin-5 is involved in the development and proliferation of eosinophils, which are cells that play an important role in asthma. Now, Reslizumab was approved by the FDA about 4 years ago. And, the pivotal studies, I think, were important. But what's lacking oftentimes are data in the real-world context. And how do drugs perform when you take the drugs and give them to patients in the real world outside of the constraints of a clinical study? So what we did in this study was we did a multi-center observational retrospective analysis of patients in the real world who were given Reslizumab, and we evaluated how they did with Reslizumab post-treatment in the real-world setting versus how their asthma was prior to receiving Reslizumab. And the key message in the largest real-world study looking at Reslizumab was we demonstrated that in the real world, outside the context of clinical trials, Reslizumab is associated with significant clinical and quality of life improvements that can be generalizable to the patients in the United States who receive this drug. And there was a significant benefit in terms of reduction in exacerbations, and as well as in terms of asthma control test scores and quality of life. So those were the key findings, basically that there's significant benefit to these patients when Reslizumab is given in the real world. There was a reduction in emergency room visits and hospitalizations that was observed as well, and suggests that this is an effective therapy for our patients.
That's excellent. And something that really stood out to me, sort of as a layman and reporter in allergy and asthma care frequently, and having discussions on biologics is, they're very, very highly touted, it seems, for, their critical care for very at-need patients, with uncontrolled asthma, the very severe symptoms. And it's great to see that, but it really stood out to me to see 6-month and 12-month outcomes for that, with it being such, it seems to be regularly applied in short bursts in very short terms. So it's great to see the tolerability and everything hold up over that time. Is that something you guys are trying to expand on, is the duration?
Yeah, I mean, we want to demonstrate that it's not only effective in the short term, but over the long term. The other thing that we looked at, which I think was really innovative, is we looked at not just a single outcome, but we looked at a group of different outcomes. And we defined patients as excellent responders, as patients who had a clinically meaningful response, partial response, and non-response. And what we found was that over 80% of patients were excellent responders, meaning they had no asthma exacerbations during the 6 to 7 month treatment period. There was another handful, about 5-6% of patients who had a clinically meaningful response. So those patients, they could have had an exacerbation, but they had a 50% reduction in the annualized exacerbation rate, and they had a reduction in oral steroid use, some improvement in lung function, improvement in asthma control test scores, or the asthma control questionnaire. And so, 85, 86% of patients seem to do quite well with this therapy.